Ladies, if you're over 65, the way you talk during your medical appointments could actually be putting your health at risk, and hardly anyone's talking about it. I've seen far too many older women walk into my office and unknowingly sabotage their own care simply because of how they express themselves. In today's video, I want to gently walk you through 7 common communication mistakes older women often make with their doctors and how to avoid them. These are simple but powerful shifts that can truly change how you're treated. Stay with me all the way to number 7, because even smart, confident women make that one without realizing it. Before we dive in, go ahead and like this video, subscribe, and let me know in the comments. Have you ever left a doctor's visit feeling unheard or dismissed? 1. Speaking too politely and not being taken seriously. I can't tell you how many older women I've seen come into my clinic speaking with such kindness, humility, and gentle manners that it almost makes you want to give them a gold star for being the perfect patient. But I need to tell you something that might feel a little uncomfortable. Being overly polite in a medical setting can actually hurt you. Doctors, especially in busy offices, are trained, whether they know it or not, to triage based on urgency. We don't just listen to what you say, we notice how you say it. So when a woman walks in and says something like, "Oh, it's probably nothing. I didn't want to waste your time," that automatically signals to us that it's not a big deal. We're human too. If you downplay your symptoms, we might unconsciously downplay them too. But here's the twist. So many of these probably nothing concerns turn out to be something. A cough that won't go away becomes early-stage lung disease. Feeling a little tired turns out to be untreated diabetes. It's not your job to decide how serious something is. It's your job to present it clearly. You don't have to shout or be rude, but you do need to be assertive. Instead of saying, "I know you're busy, I just thought I'd ask," say, "I've had this issue for 2 weeks and I need to find out what's causing it." That small shift tells your doctor you respect your time, your health, and your body. And when you take yourself seriously, your doctor will too. 2. Using vague descriptions that lead to misdiagnosis. Let's talk about a very common issue. A lovely 72-year-old woman once came in, and when I asked what brought her in, she said, "I just haven't been feeling myself lately." So I asked, "What do you mean by that?" She said, "I don't know, just a little off." Now I appreciate her honesty. But as a doctor, I need more than that. That phrase, "feeling off," could mean 100 different things. Fatigue, anxiety, dizziness, nausea, low blood pressure, heart rhythm problems, even early signs of dementia. It's like calling a mechanic and saying, "My car's acting weird," and expecting a full diagnosis over the phone. I gently encouraged her to be more specific. Eventually, she opened up. She was having dizzy spells every morning when getting out of bed and had trouble remembering little things, like where she put her keys. That was a red flag. It turned out she had low blood pressure from a medication issue and early signs of vascular cognitive decline. If she hadn't gotten specific, we might have just chalked it up to normal aging and missed it entirely. So here's my advice. Be as precise as you can. Before your appointment, write down what the symptom is, when it started, how often it happens, what makes it better or worse, and how it's affecting your daily life. That's gold for your doctor, and it can be the difference between being brushed off and actually being heard. 3. Not speaking up when something feels off. This one breaks my heart because I hear it so often. A woman says, "I figured it was just my age. I didn't want to make a fuss." Please listen to me carefully. Just because something is common doesn't mean it's normal. Yes, aging brings changes. Your joints might get stiff, your sleep might change, your skin might get thinner. But chest tightness, sudden fatigue, blurry vision, unexplained weight loss, digestive issues out of nowhere, frequent falls, those are not just age. What's dangerous is the normalization. You feel something strange, and instead of asking about it, you just absorb it. You adapt, you endure, you stay silent. But silence delays diagnosis, and delay gives preventable problems time to grow into dangerous ones. I had a woman once who'd felt a pressure in her upper chest for a few months. It wasn't awful, just something she noticed. She assumed it was arthritis or maybe reflux, but when she finally mentioned it, it turned out to be a partial blockage in one of her coronary arteries, just one bad day away from a heart attack. If something feels wrong, it probably is. Speak up. The sooner, the better. 4. Downplaying symptoms to avoid looking dramatic. There's a quiet epidemic among older women. It's not a disease, and it's not contagious. It's the fear of being seen as too much, too emotional, too sensitive, too dramatic. I see it all the time. A woman walks in with real, even serious symptoms, but instead of clearly stating what's going on, she softens the delivery. She says things like, "It's not that bad," or "I'm probably overreacting," or "I'm sure you've seen worse." Do you know what's really happening? You're trying to protect me, the doctor, from the burden of your pain. You don't want to take up too much space. You're worried about being labeled difficult or dramatic. But here's what I need you to hear, sincerely and clearly. You are not too much. Your health is not a nuisance. Your pain is not a punchline. I once had a woman come in with what she called mild abdominal discomfort. She rated it a 4 out of 10. But her body language told another story. She was pale, tense, and flinching every time she moved. When I gently pushed for more detail, she finally admitted she'd been in intense pain for several days, but didn't want to make it a thing. That discomfort turned out to be acute diverticulitis. It required hospitalization and strong antibiotics. If she'd spoken up earlier, we might have avoided all of that. Minimizing your symptoms doesn't make you brave. It makes it harder for us to help you. Give us the full picture. If it's an 8 out of 10, say it. If it wakes you up at night, say it. If it's affecting your mood, your appetite, your ability to move, say all of it. You deserve to be taken seriously. And that starts with you taking yourself seriously. 5. Letting someone else speak for you when you shouldn't. Now let me be crystal clear. There is absolutely nothing wrong with bringing someone you trust to your appointment. In fact, I encourage it in many cases. A second pair of ears can help you remember things, catch important details, and it's comforting to have someone by your side. But there's a subtle shift I've noticed over the years, and it worries me deeply. Somewhere along the way, many older women start handing over the entire conversation to their daughter, their spouse, or a caregiver. They go quiet, nod along, and let the other person speak for them. And I'll never forget one appointment. A woman named Joan, 75 years old, came in with her daughter. Joan was completely capable, sharp, thoughtful, and aware, but the daughter answered every single question before Joan could say a word. "What symptoms has she had?" I asked. "She's been dizzy," the daughter replied. "How long has it been going on?" "About 2 weeks." So I turned directly to Joan and gently asked, "Do you agree with that?" She smiled softly and said, "Well, actually, it started a month ago, and I blacked out once." That was a huge detail, completely left out. Here's the problem. When someone speaks for you, they can unintentionally misrepresent your experience. They may forget emotional context, timeline, or pain level. They see your story through their eyes, not yours. Even worse, when you stay silent, the doctor may begin to direct the entire appointment to your companion, and you start fading into the background. That's not okay. Unless you're truly unable to speak for yourself, you should be the one leading the conversation. It's your body, it's your health, it's your future. Let your loved ones support you, but don't give them the microphone. If someone tries to take over, it's okay to gently interrupt and say, "Actually, I'd like to explain that myself." You're not being rude, you're advocating for yourself. And that's powerful, because no one, no matter how much they love you, can tell your story better than you can. 6. Failing to ask follow-up questions. There's something you should know. Doctors don't always explain things well. Not because we don't care, but because we've been trained in a language that's fast, clinical, and full of medical jargon. We throw around terms like benign, mild degeneration, inflammation, or moderate stenosis, and we assume you'll know what they mean. And many older women, especially those who were raised to be polite, will nod along and say, "Okay," even when they're completely confused. That's a problem. I once had a woman leave my office thinking her diagnosis of moderate stenosis meant she had cancer. She didn't sleep for 2 weeks. She panicked, all because she didn't ask what the term actually meant, and I didn't clarify it well enough. So let me say this as clearly as possible. You deserve understanding, not just information. Understanding means asking questions like, "What does that word mean? How serious is this?" Will it get worse? What are my treatment options? What should I look out for at home? How will this affect my daily life? If your doctor says something that doesn't make sense, don't leave the room until it does. Clarify. Push back if you need to. Your doctor works for you. You are not there to impress us or make us comfortable. You are there to understand your body and your future. And good doctors, really good ones, will respect and appreciate patients who advocate for themselves. In fact, those are the patients who usually live longer, manage their illnesses better, and avoid unnecessary hospital stays. So next time you're in an exam room, don't just nod and go. Speak up. Take notes. Ask for clarity. Stay until you truly understand what's going on. 7. Not bringing notes or leaving without them. Now I want to share something very practical. This mistake is one I see all the time, and it's so easy to fix, but it has major consequences if ignored. When older women come to their appointments without notes or leave without written instructions, they forget things. Not because they're forgetful, but because that's how the human brain works, especially under stress or when you're in a place that feels unfamiliar. Let me give you a real example. I once diagnosed a woman, her name was Helen, with mild heart failure. We had a long 30-minute conversation. We talked about medication, fluid retention, daily weighing, sodium restrictions, everything. She nodded the whole time. She even said, "Yes, I understand." But when she came back 2 weeks later, her ankles were swollen, her weight was up, and it was clear something was off. I asked her gently, "Did you do the daily weighing?" She looked at me, surprised, and said, "You wanted me to weigh myself?" She wasn't careless. She simply forgot. And that small misstep could have landed her in the hospital. Here's what I want you to do instead. Before your appointment, write down your symptoms, when they started, what makes them better or worse, any recent changes in medication, sleep, appetite, or energy, and any specific questions you want answered. During the appointment, bring a small notebook. Take notes while your doctor talks, or if writing is hard for you, ask your doctor to write it down for you. Most of us are happy to do that. Or bring a companion who can take notes for you. Just make sure you understand what's written. Afterward, go home and review the notes. Keep them in one place. Bring them to your next appointment. Refer back to them if something changes. Because your health isn't a one-time event. It's an ongoing story. And without notes, you're relying on memory. And even doctors forget things if we don't write them down. So treat your notes like a health journal. They'll help you stay organized, informed, and in control. So let's go over these again. The 7 communication mistakes that could be standing between you and the care you deserve. 1. Speaking too politely and not being taken seriously. 2. Using vague descriptions that confuse your doctor. 3. Staying silent when something feels wrong. 4. Downplaying symptoms to avoid seeming dramatic. 5. Letting others speak for you when you're capable of speaking for yourself. 6. Failing to ask follow-up questions. 7. And forgetting to bring notes or leaving without them. If even one of these sounds familiar to you, I want you to know you are not alone. But you can change the way you show up in the exam room. And the moment you start communicating clearly, confidently, and directly, the care you receive will change too. Because you matter. Your story matters. And your voice, especially in a doctor's office, is worth hearing. Take good care of yourself. And if this helped you, please share it with a friend, sister, or mother who might need this message too. You deserve to be heard.